We continue with our coverage of healthcare systems around the world. We have been reporting on how those systems compare to healthcare in the United States. Tonight, New Zealand. All of the residents there are covered under the publicly funded system, and life expectancy there is 80 years. Brooke Baldwin has our report.
New Zealand, a country of more than 4 million people and a land known for its extraordinary beauty. It is here on this island country in the Pacific Ocean that healthcare meets high tech. Bruce Pollock heads a business that arranges trade and study missions for senior U.S. healthcare representatives. He says New Zealand has one of the most impressive healthcare systems he's ever seen.
New Zealand is far ahead of most countries in terms of its use and application of technology. 99% of primary care physicians have an automated patient record. The hospital care is all automated and all the ancillary results are automated.
New Zealand offers universal health care to all its citizens. The extensive use of technology has helped keep healthcare costs down. New Zealand spends $2,510 per person versus $7,290 in the U.S. And healthcare consumes 9.2% of GDP versus 16% in the U.S. The healthcare system is financed through general tax revenue, while care in a public hospital and a visit to a specialist is free of charge. New Zealanders do pay approximately $50 to see a primary care physician. Not exactly small change, says Professor Steve Ullman, who teaches healthcare management and economics at the University of Miami.
You have an interesting incentive structure because a $50 copay is not an insignificant amount for primary care. And so you might have patients that are going to be thinking twice before they go see their primary care doctor, probably only going to see the doctor when things are a little bit more serious.
New Zealand has fewer doctors than most developed countries, including the U.S. One for every 434 people versus one for 416 in the United States. Doctors used to be paid on a fee-for-service basis, but the payment structure was changed about 6 years ago. It's now based upon the number of patients.
With a fee-for-service structure, you tend to have an implicit incentive to do more to a patient rather than to do what's necessarily best for the patient.
As is common with universal healthcare systems, access to care for elective procedures can involve a long wait. About a third of New Zealanders purchase private insurance for elective procedures. This insurance reduces waiting time, gives access to private facilities, and enables patients to pick their own surgeon and hospital. And how about this? In New Zealand's public healthcare system, no one is on the waiting list for more than a year. And if the waiting times are too lengthy, there is the possibility that the government will subcontract out care to the private sector. Lisa, how about that?
Now, that's not too shabby. Thanks, Brooke, for that report. And we'll continue our reporting on healthcare systems